Greetings. It's a real pleasure to be with you all here and to share the TCI platform and our partnership with local governments to sustainably scale family planning programming, as well as our experience in Nigeria and how we are planning to use the Consolidated Framework for implementation research to understand more about program implementation. With this, I'm delighted to introduce my colleague Olumesi Yemisi Ishola, who's the lead research monitoring and evaluation advisor with TCI in Nigeria, who will walk us through the TCI model and the Nigeria experience. And then I am Sarah Jane Holcomb, the senior learning advisor with TCI, and I will talk a little bit more about how our team is collaboratively adapting CFIR for our comparative case study. Thank you. Over to you, Yemisi.
Thanks, Sarah Jane, for the introduction. Good morning, good afternoon, good evening, everybody. I'm delighted to be here. Like Sarah Jane mentioned, I'm going to be presenting a brief of the challenge initiative, and then later in the presentation, hand over to Sarah Jane to take us through the CFIR methodology. Next slide. No, slide 1. Okay, so briefly, I'm going to be introducing the challenge initiative. The challenge initiative, also known as TCI, is a platform. We pride ourselves to call ourselves a platform rather than a project. It's a platform that enables local governments to scale up high-impact family planning approaches with a focus on urban poor. And I will tell you why during the course of the presentation. TCI presents a highly innovative approach to development aid intended to strengthen the understanding of scale, impact, efficiency, and sustainability. Our hypothesis is hinged on the premise that scaling without impact is empty scale. This means that it is not enough for us to scale where there are no tangible results. And then also impact scale without increasing cost efficiency is not viable, as it is expected that the cost of implementation should reduce as the program expands to other territories. And then finally, cost-efficient impact at scale that is not sustainable will not produce lasting change. We have seen partners in family planning and program come and go in Nigeria, and the programs are not sustainable. And so TCI works to deliver on achieving sustained impact at scale. TCI launched in Nigeria or globally in 2016, and TCI has demonstrated that the business unusual approach can actually change the way business is done in the development landscape. And currently, we use family planning as an entry point, anticipating that in the near future we would expand to the maternal and neonatal child health spectrum. Next slide. I'm going to be touching on TCI's 6 major guiding principles that guides its implementation model. The first is demand-driven, and this means that unlike other implementers, local governments choose to enter into partnership with TCI through expression of interest. And when these states express interest, we assess their political and financial commitment as the foundation of our partnership. And then also, we are big on local government and systems ownership. We don't just want to implement and government is not involved. We want government to be fully involved in what we do. And then we get them to commit to identifying gaps that we have seen during the course of our landscaping analysis prior to implementing in those states. And then also, after identifying all the challenges that we have seen in their family planning and reproductive health landscape, we then simplify the proven to work interventions that we have codified and support the government to select right-fitting interventions that can give quick wins and have potential for scale-up and also sustainability. Also, we are big on leveraging on existing platform, and that is one unique feature of the challenge initiative, That's the ability to work with existing platform and government systems and not running a parallel structure. And we also support government to harness opportunity from other sources, which could be within the government and also outside the government, like other implementing partners and resources. And then also the Challenge Initiative has a big platform that is online that we call the TCI University. And TCI University has global best practices with family planning program that has been developed over the past four decades. And they are all showcased and readily accessible on TCI University. And then also we use our coaching platform, which is robust to support local governments to scale up their family planning intervention. I'm going to be touching a little around our coaching methodology during the course of the presentation. And then finally, we are big on the use of data for decision making because we know that evidence is very critical for scale up and sustainability. So the Challenge Initiative uses near-time, real-time data for decision making. And one other unique feature is the ability to use government data and not necessarily program data to make such critical decisions to improve the family planning landscape in the states where we work. Next slide. Okay, so I would try to summarize how TCI works with the cities that we currently implementing. Like I mentioned earlier, government self-selects to be part of TCI. And after cities self-select to be part of the platform, TCI works closely with local government counterparts to design a program or their family planning program using the best practice approach available on the TCI platform and also the interventions that we have codified and have been tested to work. Then the city commits specific amount of funding for their family planning program to assess what we refer to as the challenge fund. So once a state contributes a certain amount, they are able to unlock some form of funding from the Challenge Initiative. And TCI not only provides cities with technical coaching for adaptive and implementing the best practice approaches, we also provide coaching in various aspects of effective management, specifically for policymakers and also political officers. And then this ensures that the gaps that were identified are prioritized and they are mapped into the TCI proven interventions in the TCI University online platform. Like I mentioned earlier, our coaching is very big and it helps governments both at the hub level and also at the implementing level to select and implement activities that they know would give them the mileage that they want to see in their states. And then eventually, TCI takes the assist phase where we just help them to implement, stay back and watch governments effectively implement these interventions by themselves. And this culminates to graduation when we have seen evidence that the government leadership, the government counterparts, the implementing providers are able to carry on these interventions without TCI's support. That is where we say that the states or the government of the states have potential to transition to self-reliance. Next slide. Okay, so after the first 4 years of TCI implementation, we can boldly say that we currently deliver evidence of scale, impact, and cost efficiency in about 109 cities across the 5 accelerator hubs where we implement. We call them accelerator hubs because there are some hubs that have a combination of different countries. For instance, we have the East Africa that is currently implementing in over 5 countries. We have the Francophone West Africa, we have the India hub, we have Nigeria, and then currently we have the Philippines that have joined the accelerator hubs. And in Nigeria specifically, TCI implements in 12 states representing the 6 geopolitical zones. And then globally, local government cash contributions have reached over $152 million. That is nearly 4 times the amount that TCI contributed through the Challenge Fund, which is about $32 million. Next slide. So this actually presents as a snapshot the positive impact of TCI across all the 5 accelerator hubs and the 109 cities where we work. So in terms of family planning client volume, we have recorded an increase of over 41% from the period where TCI commenced implementation up until the end of year 4, which is June 2020. And this has led to over 1.2 million additional users of family planning across the facilities that we support in this hubs. And then this has led to over 2.3% annualized model change in MCPR since TCI began implementation up until the end of year 4, which is at June 2020. Next slide. So we're going to go right into Nigeria specific results, but before we go into the results, just to show a snapshot of Nigerian demographic context. So from the reproductive health indices that we are all seeing, we can see clearly that Nigeria is still grappling with high fertility rates, and high unmet need with low use of contraception, especially modern contraceptives. And evidence has also shown that urbanization is alarmingly increasing across major cities in Nigeria. Thus, the focus on urban poor. Recall I said I was going to say why urban poor, and it's as a result of increasing migration of people from the rural into urban cities, thereby putting a lot of pressure on the health system in the urban cities. And so that's why TCI is majorly focused on the urban poor. Next slide. As I've mentioned earlier, TCI Nigeria currently implements in 12 states and with similar goals as TCI Global goal, which is to empower state government to scale up effective family planning and adolescent youth sexual reproductive health interventions among the urban poor. Specifically for Nigeria, TCI commenced core implementation across states in 2017, and TCI is currently in its 5th year also in Nigeria. Next slide. Next slide. Okay, so I'll briefly talk about the TCI model in Nigeria. So for us in Nigeria, TCI implements what we refer to as a 3-pronged implementation approach using advocacy, demand generation, and service delivery thematic areas. Research, monitoring, and evaluation is a cross-cutting thematic area that supports or provides evidence of implementation around these 3-pronged approaches. And under advocacy, TCI aims to increase voice, accountability, and changes in values, beliefs, and norms, and also foster favorable supportive policy environment for family planning. This happens at the individual level and also at the policy level. For our demand generation activity, the DG activity aims to build local capacity to generate demand using a combination of media and community engagement strategies. Service delivery targets improvements in access to high quality family planning. And just to mention here that these interventions are locally led and they are customized to suit the different states' contexts. Next slide. So I'm just going to quickly talk about the impact of TCI in the states where we implement using the family planning client volume as a case study. So looking at how we started in this state and where we are in the 4th year of implementation, TCI has recorded over 107% increase in the number of women that come to the facility to access family planning services. This is a huge shift from where the state used to be prior to TCI implementation. Next slide. So for also looking at the national total in terms of the number of clients that come to access services versus TCI States, we have also seen a huge shift in terms of model change in MCPR. Even though across board we could see some level of change in the MCPR, 1 year after TCI implementation and 2 years after TCI implementation. But we can see clearly here that TCI states have stronger performance than the national average. Next slide. So touching a little bit about the funding commitment of states and what they've released so far to implement family planning program. We can see here that there is a huge shift. But just before we deep dive into the results, I just want to mention that having a budget line for family planning in Nigeria is a big deal. And when TCI commenced implementation, part of our startup activity is to ensure that all the states have budget lines for family, specifically for family planning program. And we can say that all of our implementing states currently have a budget line for family planning. Even though they have budget line, another big deal is releases for implementation. And from what we have seen so far, we know that budget releases is a Herculean task because most times you have budget line, government don't release money. But during the course of TCI partnership, we have recorded tremendous increase in government releases and expenditure, specifically for family planning implementation. For instance, between year 3 and 4, we can see over 36% increase in fund releases across the states where we work. And overall, so far, the governments of the states where we work have released over $2 million for family planning implementation only. This is a huge win for us in the challenge initiative. Next slide. So just to briefly touch on other key achievements that we've recorded in Nigeria, I want to mention here that TCI as a program has supported states to make the shift from partner and funders coming in with their agenda and the states agreeing to it, to a model where the state sets its own priorities and coordinates partners, resources, and donors in the state around its own state-led agenda. So state already has its agenda and gets partners and other donors to align to those agendas. And then what has really worked is also having family planning costed implementation plans and the annual integrated family planning work plans has really ensured institutionalization through inclusion of proven family planning AYSRH high impact intervention to support the state's interventions. And then also across all of our states, we can boast of strong and functional coordination groups and systems that are active and they are performing their roles in different ways to improve voices and accountability, to create demand for family planning, and also to make sure that budgets are released accordingly. And then this has also led us to having an increased pool of government family planning advocates and coaches at the state and local government level. And this has also supported quality of service delivery for family planning program in those states. So this is just to give us a quick snapshot of where we are in TCI Nigeria. I'm going to be handing over to Sarah Jane for the remaining part of the presentation. Sarah Jane.
Thank you so much, Yemisi. Right now, I want to Yemisi has set me up to share where we are as TCI entered the 5th year of partnership with local governments, working to achieve sustained impact at scale. We knew that we wanted to strengthen how we do our work together. And to do this, we needed to gain a more systematic and in-depth understanding of how states make progress in partnership with TCI, especially given the ever-changing context in which we work. While states' health HMIS service statistics data provide important insight about how TCI partnerships progress, they don't reveal detailed information about implementation and system strengthening processes. We also really wanted to make sure that the perspectives of government stakeholders are heard and that they feed into platform improvements. And as we all know, resources are limited and we want to make the best use possible of the time, the people, and the finances that we have available. We want to know can we streamline, what should we stop doing, what should we do less of, and what should we do more of. We therefore turn to the Consolidated Framework for Implementation Research, or CFIR, as an evidence-based tool to open the black box of program implementation. The CFIR was developed with the objective of narrowing the no-do gap in health services research. This is a gap that has been shown between what has been shown to work and what we know works and what most organizations are actually doing. The framework consists of 5 domains with 39 constructs. These constructs reflect the constructs found in the research literature to be most likely to influence successful implementation of interventions. The domains and constructs are arranged within a multi-level ecological conceptual framework, which is consistent with others used in the field. And I'm sorry, that is one of the most ugly graphics I've seen, but we'll work harder in later research to present something more streamlined. The CFIR is ideal for strategy design, evaluation design, informative investigation, and for us, we saw its use for unpacking and strengthening TCI implementation processes because it builds on the accumulated research evidence about what works to speed uptake of health interventions and can help capture the complex multi-level nature of implementation and interventions, particularly as is the case for TCI. And it's oriented towards offering results to people who use research to implement, not just to produce knowledge. And especially key for us, it's customizable. While it's a huge framework with many constructs, we can strategically choose those most relevant to us. So how we're adapting CFIR for our use is through its incorporation in a comparative case study, which explores the experience of local governments in partnering with TCI and TCI in 3 of TCI's 5 regional hubs. And here we'll look at Nigeria. Our aim is to look at what government features and strategies are linked with strength and family planning programming and how the strategies were put in place, as well as what aspects of TCI interaction with local government have most contributed to enabling government to strengthen family planning programming. We had a 2-stage process for selecting sites. This involved first using service statistics, HMIS data, to identify low and high performing states. And then we did a more in-depth qualitative assessment of the progress these states had or had not made in strengthening health systems. Data sources that we chose to do were primarily key informant interviews with local government leaders and managers, external informants, as well as TCI hub coaches. But we also draw on project and HMIS data. And here you can see the rich detail, much of which we went over in our Nigeria team site selection meeting, where we first started with identifying those which were high performing or lowest performing in terms of service statistics, but then really took a dive in terms of getting a take on which states had made progress in strengthening their systems. I won't go into the detail, but you can review this later online. And what we did in using CFIR was an iterative adaptive experience. We really had to do an intensive adaptation of the CFIR domains and constructs to make it real for TCI's model and context. The interview guides and code books were anchored in the CFIR domains, but adapted with TCI Nigeria examples and vocabulary, as was the case for our other hubs. Those CFIR constructs identified as not applicable to TCI were not included, such as trialability or cosmopolitanism. We developed also a series of codes for TCI strategy components, which we included in the implementation process domain. And that's where we think we will really have a lot of important learning there. Our analysis will focus on the domains of most strategic relevance to TCI, that of intervention characteristics, the inner environment of government, implementation process domains. And we're also going to be particularly interested in constructs that are modifiable. If you can't change a construct, I mean, that offers less scope for progress moving forward. Here, I'm going to share the first two cuts in our analysis plan. We are first going to put together a matrix examining by state and by TCI strategy component, whether each prioritized CFIR construct is either a facilitator or a barrier to state implementation of TCI interventions. So I put together a dummy table for you that shows how we'll carry that out. The next cut will be identification of actionable findings for strengthening TCI strategy components. And this is going to be by looking at interview excerpts that are jointly coded for a particular TCI strategy component and a particular sort of construct in the 3 domains that are a priority for TCI. We're at the early stages of analysis, but we have some preliminary lessons from CFIR adaptation to multi-level systems. The framework, the CFIR framework, when applied beyond health service delivery systems, requires substantial contextualization in close coordination with implementers and TCI coaches. And the complexity of the TCI platform made iterative review and revision with Nigeria team members particularly key. And that was conducted through a series of document review by Nigeria team members, but also a series of joint meetings where substantial constructive feedback was received. I again cannot highlight enough how systems change, which is integral to the TCI model, is taking place at 3 separate levels of government in Nigeria, as Yemisi alluded to, at the local government area, at the state government level, and at the national level. And so the complexity of that and having that reflected in constructs is something that we are even now grappling with. And finally, the implementation process domain appears particularly helpful for us and for others who are interested in making mid-course improvements. So I'll stop there, but we very much look forward to sharing the results of our analysis when they come out. Thank you. And I do want to sort of encourage folks to attend other sessions here in this conference. Colleagues are presenting on the most significant change methodology for adaptive management that TCI uses, as well as a series of other sessions. And I think they'll be super informative for you. Thank you very much.